So let's now put everything together. What we started talking about early on was this, autoregulation, right? That at the capillary beds, your precapillary sphincters are going to open and close in response to busy factors, right? CO2, oxygen, pH, and so on. Now, I also said that that system only works if there's sufficient blood pressure systemically to make it work. Remember, capillary beds don't have a pump. They're entirely dependent on the cardiovascular system's pressure to move the blood, right? So as long as systemic blood pressure is adequate, we're down here in autoregulation. But we know that that isn't always the case. So let's go through an example, right? So we're in homeostasis, and we have a disturbance. Could be any number of things, right? Physical stress, chemical changes, whatever. Okay, so then we get inadequate local blood tissue control, right? So we get inadequate blood flow. So we have lots of total peripheral resistance, or a big decrease in TPR, right? We got lots of tissues that aren't getting enough, lots of vasodilation. So a decrease in resistance, increase in flow. Now, if there's enough blood pressure, we come around the corner, that fixes the problem. But if there isn't enough blood pressure, then we're up in here. And we have endocrine mechanisms and neural mechanisms. We've talked about both of those. Humoral and nervous system control of blood pressure, right? So if blood pressure is not sufficient at the microcirculation level, then we move up into the central regulatory systems. On the neural systems, right, we get stimulation of sympathetic and inhibition of parasympathetic. That triggers a short-term elevation in blood pressure. That's going to help with our initial problem, right? Also, our endocrine mechanisms, that's the renin-angiotensin-aldosterone system, is going to result in this release of angiotensin 2 and aldosterone, which is going to also increase blood volume and pressure and fix the problem, right? So this is happening all the time. Up here is happening when there is a significant disturbance in blood pressure, when there's not enough blood pressure to meet the needs of the body, right? To meet the needs of many tissues. Okay, so that's putting it together. Now let's look at some examples of how these systems are intermixed, okay? So here we are in homeostasis. Let's do the up side first, okay? So something happens, our blood pressure goes up, okay? So that could be stress. It could be the addition of plasma volume. It could be lots of things, right? Blood pressure increases, baroreceptors detect that, right? They increase their firing rate. That is detected by the brainstem, right? And so the baroreceptors detect, blood pressure too high. Body responds with inhibit the inhibitory center. So in other words, turn down the heart, turn down heart rate, turn down contractility. So the two cardio-inhibitory centers. We're going to inhibit the vasomotor centers, right? So we're going to slow down the heart rate and contractility, and we're going to cause systemic vasodilation. So we're going to reduce stroke volume and total peripheral resistance, right? Reducing stroke volume is going to reduce cardiac output. So if we reduce cardiac output and total peripheral resistance, well, guess what? Our blood pressure is going to have to go down, right? So now we're back to our normal range. It's an example of these systems in action, right? Now let's do the reverse one. This one's actually much more common. Normal blood pressure, we have a reduction in blood pressure. Baroreceptors are inhibited, right? So they slow their firing rate into the brain. The brain detects that as a reduction in blood pressure, stimulates everything, right? So cardio-acceleratory centers are stimulated, the inhibitory center is inhibited, the vasomotor centers are stimulated. So what do we get? Increased vasoconstriction, more TPR, right? And increased cardiac output, both of which will raise blood pressure. So now we're back into our normal range again. So this is very much the the nervous system's response. If you look, there's no renin-angiotensin-aldosterone system in these diagrams, right? We're getting there, but this is the nervous system's control of too high or too low through the baroreceptor detectors and the brainstem's cardiac control centers, okay? Now, let's look at that. We're going to add to that the hormonal control, right? So this, the previous one, come back here, the previous one, this is going to happen within seconds to minutes, this one. It's all nervous system, right? Nervous system fast. That's why we evolved it in the first place.